So you have an osteoarthritic hip joint, and what does that mean? It means that the ball of your hip has lost the cartilage on the surface of the bone, and the socket that the ball moves in similarly has lost the cartilage. And there's no successful treatment for that when it reaches that stage, given the symptoms it's causing for you, other than a hip replacement. So the typical patient who has reached the end of the road with regard to their arthritic hip is limping when they walk, particularly at relatively short distances. So maybe 12 months ago you were able to walk 5 kilometers before you limped, and now it's down to 1 kilometer. That type of progression in line with your x-ray would suggest somebody who's heading towards a hip replacement. You may also find that turning in bed at night causes a sharp pain in the groin, which would be a classic sign of a hip that's failing and running out of options. And the other one is around activities of living. You may be struggling to cut your toenails, tie your shoelaces, put on stockings, and these kind of signs are indicating to me that you're edging closer to a recommendation for hip replacement.